Working with one of the poorest counties in Michigan, and my patients depend on expanded Medicaid. So how is that going to affect my patients?
Yeah. I hadn't heard about cutting some Medicaid.
So that was Dr. Rob Davidson, who is a healthcare provider. He's a doctor, and he was calling out Mike Pence to his face on the recent Medicaid cuts. So now Mike Pence, obviously you could see there, was denying knowledge of his own administration's plan to turn Medicaid into a block grant program. So now let me give you some details about the program, about what they're trying to do. Uh, Under the new program, states who file a waiver would be allowed to use a formula to determine ahead of time how much it will spend on its adult Medicaid population and then get that fixed amount for the entire year. So again, that is a block grant that they will literally ask for. Now, that grant can be used not just on healthcare, but maybe to plug budget holes or fund other programs. I did a video earlier today that lays out what's exactly in that plan, but it's not good for people who are poor and disabled. Now, the result of it ultimately is a cut in Medicaid and to try to get less people to be on that program. So now, here's Dr. Rob Davidson, as I said. He is somebody who actually cares about his patients, and he sees a lot of people that are on Medicaid that need this program to be able to get the health care that they need. So now he's going to continue to press Mike Pence on this and check out his response.
When I was governor of Indiana, we got a waiver from the Obama administration that actually allowed us to expand Medicaid coverage in the states.
Right, but now they're talking about scaling back the Medicaid expansion that we got with the Affordable Care Act, and that 680,000 Michiganders, 600,000 in Iowa. I mean, a lot of people got health care.
We expanded coverage in Indiana.
Right, but I'm just talking about the president and your administration right now, what they're doing. Right now, they're cutting Medicaid.
Those are waivers for states that didn't take expansion.
No, it's for people who took expansion money too. I mean, your administration just announced this; they rolled it out today, and it's going to affect millions of people across the country cutting Medicaid. I mean, is that a good idea or is that a bad idea?
I think you're oversimplifying it.
Well, I think it comes down to that for the people I take care of all the time. I mean, people I see in the emergency department that can't get primary care doctors. You know, once they got Medicaid, they could get primary care doctors. They stay out of the ER. They actually work more. They actually contributed to our community more. Now, if we tell those people, sorry, you don't get your health care, I mean, that's going to be a real negative in their lives.
Yeah. Well, if you check out what we did when I was governor of Indiana, the Healthy Indiana Plan, which was the first consumer-directed waiver that was given ever, we expanded coverage, we used consumer-directed health care. People were able to take more ownership of their own health care and expand it.
I mean, I think if the Trump administration, you do want to expand Medicaid, that'd be great. But the problem is they're contracting Medicaid.
I love this. So, for one, Dr. Rob Davidson, you're badass. That's awesome. So I love how he's calling out Mike Pence there. And I love his reaction, right? Pence's reaction. Indiana, look what we did in Indiana. We had, what was it? Patient-centered or consumer-centered healthcare or something like that. What is that? No, healthcare is healthcare. If you provide people, and this goes to a wider argument about actually having Medicare for all, we don't want like consumer-centered healthcare because, you know, we shouldn't be consumers. Healthcare is a literal human right. Everybody needs healthcare. We shouldn't be treated as customers. This isn't buying Nikes. We're not picking out a cell phone. Okay, this is healthcare. This is literal life or death. But okay, he says, well, okay, look at what we did in Indiana. I mean, I expanded Medicaid. I expanded healthcare. All right, well, what did he do? Now, it turns out that Indiana did expand Medicaid, but his state ended up getting a special waiver from the Obama administration. So now in this waiver, it stipulated that enrollees to the Medicaid program actually had to contribute to a health savings account. If they failed to do so, then they were at risk at losing their benefits. Now, those the people that are enrollees to Indiana's Medicaid program also had to pay premiums and had work requirements put on it as well. And now That's what he did. He did the very most conservative version of being able to expand Medicaid that they could do. Not exactly generous. And yet the Trump administration says, you know what? Too generous. We're going to shift the block grants and basically let the states be able to cut Medicaid if they want to. As far as Pence not knowing, I wasn't aware that we were going to cut Medicaid, complete and total fabrication. And then deflection after deflection. Look at what we did in look, we expanded healthcare. It was super, super, super conservative, but we expanded it. Oh, yeah. And then a complete, of course, denial of what the administration is doing. He absolutely knows. And Dr. Rob, man, called him out on it to his face. And that's awesome. Now, after the exchange, he went on Twitter and he said, quote, I confronted him about his damaging healthcare cuts because for me, it's not about politics. It's about saving lives. As he is a doctor, of course, he would know that. He said, when I told him he's putting my patients' lives at risk, the vice president deflected and denied knowledge. He either doesn't understand or doesn't care about the impact of the administration's policies on patients everywhere. And look, man, I think it's the last one. I think he doesn't care. I think to a lot of these Republicans, a lot of these conservatives, they think that poor people don't deserve health care. They don't believe that it's a human right to show compassion to the sick and the poor without them paying for it first, right? Because to a lot of these people, poor people are takers. People on welfare, people on food stamps, people on Medicaid, well, they're just takers. They're taking my money. Well, why should I have to pay for them? Well, when I don't have health care. Well, you know what? That's why we should have Medicare for all. Everyone in, no one out. Everybody gets covered. But I just want to thank Dr. Rob for doing this, for exposing Mike Pence for who he is. Now, the video that I showed you has been getting a lot of views. I'm going to put the link in the description so you can share that around, so you can share what Mike Pence was caught doing, lying and deflecting. And you can see Dr. Rob challenge him as a healthcare professional. Share this video, share that one too, so that the world can be reminded of just how loathsome Vice President Mike Pence really is. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know how I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.